Hi, my name is Kathy. Today I would like to talk to you about developing a therapeutic relationship between you, the emergency room nurse, and your patient. Trust plays a huge role in the healing process. The patient must feel that they can trust you and be able to tell you their symptoms without fear of judgment or embarrassment. Since you are the liaison between the patient and the doctor, it really is imperative that you develop this trust early on in this relationship. If a patient doesn't feel comfortable or trust you enough to tell you what's bothering them, no matter how embarrassing it is, you may not be able to provide the necessary treatment. I've learned various techniques throughout the years in working with the public, and I'd like to share some with you. There's a couple of things that you can do to build that trust early on in the relationship. The first thing is upon meeting the patient, look them in the eye, smile warmly, and extend your hand for a handshake. Now, the handshake may seem something that's insignificant. However, it is contact, and it is a personal connection with the patient. Ask them how they'd like to be addressed. Different generations prefer to be addressed in different ways. They may have a nickname that would make them feel more comfortable. And a young teenager is probably only used to being called Mr. when he's in a significant amount of trouble. You want the patient to feel that they are the only thing that you're concerned with at the moment, that you are thinking about them and only them and how to make them well. Discussing child care issues or complaining about traffic or car problems may make them believe that they're not getting the best quality of care because you are thinking about personal problems, not concentrating on them. Never question or negatively comment about a peer or a fellow employee. This may cast doubt in the patient's mind. Never say something like, geez, I wonder why she did it that way, or we never do it this way. If you have a question about how a peer did something or why they did something a certain way, find them, pull them aside out of earshot of the patient, and discuss it. Try to engage the patient in conversation. Find out who they are and show an interest in them. Ask about their hobbies, where they work, or where they went to school. Finding common ground will help them relax and hopefully take their mind off of what ails them at the moment. Because this is your job and you know what needs to be done, does not mean that the patient knows what needs to be done. Something as simple as taking a patient's vitals may seem almost mechanical to you, but it could be very foreign to a patient. Tell them what you are doing and why you're doing it. The Velcro on a blood pressure cuff can be very startling to somebody who's already on edge. If someone knows you're about to touch them, they may not be as startled. Some people don't like to be touched. A simple statement such as, Mr. Smith, I need to take your blood pressure, would minimize the shock of the noise. Or, Mrs. Jones, I need to take your pulse. Then they know that the touch is coming. After you've taken the vitals, let the patient know the outcome of those vitals. They don't need to necessarily understand exactly what it is, but saying something like, your blood pressure is 110/70, that's perfect, exactly where it should be, will make them feel a little bit more comfortable. Another thing is be honest and don't forget about your patient or don't make them feel that they're forgotten about. Most people do not realize that lab results in an emergency room can take up to 90 minutes at minimum. The patient should know this. Some patients won't leave the room to go to the bathroom in fear that they may miss the nurse or the doctor. Let them know and let them know that if they have to leave, that you will come back and find them to give them the results. If they have to go to CAT scan or they have to go to MRI and there are more pressing patients in front of them and you misjudge the time it would take to get them down there for those tests, own up to it and let them know. Pop your head in once in a while just to ask if there's anything you can do to make them more comfortable. This will at least let them feel that you haven't forgotten about them. A trip to the doctor's office or emergency room is absolutely terrifying for a lot of people because it's the fear of the unknown. The only thing that they're certain of is that they are not feeling well, very uncomfortable, and that they have to rely on a stranger to help them. Hopefully, by utilizing some of the techniques that I've shared with you, you'll be able to help put your patient's mind at ease and have them remember you as a warm, kind, and considerate nurse that made their trip to the emergency room just a little bit better.